Hey everyone, my name is Brooke Wallace and my presentation is on rheumatoid arthritis. So what is rheumatoid arthritis? Rheumatoid arthritis, also called RA, is a systemic autoimmune inflammatory disorder. The specific cause is unknown. However, research has identified potential contributing factors. Genetic factors include T cells, which maintain a properly functioning immune system. So if T cells attempt to correct abnormalities in joints too quickly, it causes inflammation and tissue damage, which is associated with RA. Individuals with the presence of gene marker HLS have a 5 times greater risk for RA. Environmental factors include bacteria and viruses, exposure to secondhand smoke, air pollution, insecticides, and exposure to occupational hazards such as mineral oils and silica. Personal factors include gender, age, family history, obesity, and response to stressful events. 70% of individuals who are diagnosed with RA are women. This may be due to a variety of hormonal factors that are involved in the development of RA, such as oral contraceptives or breastfeeding. RA typically presents in those between the ages of 40 to 60, but there are cases of juvenile rheumatoid arthritis. If RA is part of your family history, then the risk of developing the disease increases. Description: rheumatoid arthritis is an autoimmune disease in which the body's immune system incorrectly attacks the joints. RA creates inflammation that causes the synovium, which is the tissue inside the joint, to thicken. The synovium is responsible for making a lubricating fluid inside the joints to help them move smoothly and inhibit deterioration. The thickened synovium creates swelling and pain in and around the affected joints. So here is a picture I found that compares a normal joint, cartilage, and synovial membrane in comparison to a joint that is affected with RA, so you can see how the inflammation affects the joint. Characteristics. Anatomy involved. RA is most commonly found in joints of the hands, feet, wrists, elbows, knees, and ankles. The joints are affected symmetrically, so you wouldn't just have RA in your right wrist, you would have it in both wrists. RA is systemic, so the entire body can be affected. This means cardiovascular manifestations such as pericarditis, myocarditis, valve disease, and pulmonary manifestations such as pleuritis, pulmonary fibrosis, and pleural effusions. Common symptoms of RA include fatigue, minor fever, loss of appetite, skin rash, muscle aches, neck pain, and that is if the RA is in the cervical spine, morning stiffness, and weight loss. Less common symptoms include shortness of breath, dry eyes and dry mouth, rheumatoid nodules, which are small lumps that form under the skin over bony areas that have been eroded away. These nodules are usually firm and usually do not cause pain. Inflamed blood vessels. This can lead to damage in the nerves and skin, resulting in numbness, tingling, and burning. This is referred to as rheumatoid vasculitis. And anemia. Courses. So there's 2 types of progression of RA. The first is monocyclic progression. This is a short-lived episode of RA with symptoms that last only between 2 to 5 years. This progression is usually the result of an early diagnosis and immediate aggressive treatment. The second progression is polycyclic progression, which is the constant recurrence of RA symptoms and flares. The flare-ups fluctuate in stages. Patients may go long periods of time without experiencing any symptoms, but the flares will usually return. There are 4 stages of RA. The first stage is the initial inflammation stage, in which the joint capsule and swelling of the synovial tissue occur. This results in clear symptoms of joint pain, swelling, and stiffness. Stage 2 is the moderate stage of RA. The inflammation of synovial tissue worsens and causes cartilage damage. This results in loss of mobility and range of motion. Stage 3 is considered severe rheumatoid arthritis. in which inflammation is destroying cartilage and bone. So this results in decreased mobility, decreased muscle strength, and development of physical deformities. This is a stage in which you would start to see nodules and like boutonniere or swan neck deformities. Stage 4 is the end stage. The inflammatory process ceases and joints stop functioning, so joints are contractured at this point. Pain, swelling, stiffness, and loss of mobility are still primary symptoms. Effects on normal structure. Here is a picture of a hand, and it shows the joints of the fingers going from a healthy joint to an arthritic joint. So this involves swelling, in which synovial tissue and joints become damaged, causing the tissue to thicken and swell. Stiffness. Inflamed joints tend to stiffen and become difficult to move. Joint stiffness is most common in the mornings or after long periods of rest. Pain. Cartilage and bone within the joints will wear down over time. The muscles, ligaments, and tendons that surround the joints will weaken and no longer provide stabilization to the joint. This causes intense pain and joint damage as well. And then redness. Joints can be warm and may appear pink or red from the inflammation. Here are some pictures that I found of rheumatoid arthritis. I know it's more commonly seen in the hands, but I found a picture of an arthritic foot as well, and you can see the joint deformities here. This is a diagram of a hand that's in the late stage of RA, and so it shows boutonniere deformity of the thumb, ulnar deviation of the MCP joints, and then also shows swan neck deformities in the fingers. Functional impairments. So decreased strength is very common with RA, and this is going to affect your ability to grasp objects and complete daily activities. Decreased joint range of motion will create difficulty with mobility and fine motor manipulation. ADL and IADL interference is common, especially with dressing, cooking, driving, completing hobbies. Job skill impairments may be present. Fine motor job skills such as typing, writing, or mechanical work will definitely be impaired. Medication, healthcare cost. RA is very costly to manage because of the medication and the frequent doctor's visits, so this could be a financial burden. And then pain can cause psychological stress, which can negatively impact daily activities and sleep. Incidence rates and statistics. About 1.5 million people in the United States have rheumatoid arthritis. Nearly 3 times as many women have the disease as men. In women, RA most commonly begins between ages 30 and 60, but in men it occurs later in life. Having a family member with RA increases the odds of having RA. RA affects all races, and prevalence is not affected by climate. Method of diagnosis. RA is officially diagnosed by a rheumatologist. Rheumatologists are interested in the following. Family history. So they ask for the medical history of the patient to see if RA or other arthritic diseases run in the family. Blood test, which tests for inflammation levels and antibodies in the blood. And then imaging scans, such as an X-ray, ultrasound, or MRI, may be used to detect joint damage. It's important to note that no single test can determine if a person has RA. Rather, rheumatologists use a combination of tests to make an accurate diagnosis. So this is the scale that they use when they are looking to see if someone has RA. This is the classification criteria for RA scale. And in order to be diagnosed, you have to have at least one swollen joint, absence of an alternative diagnosis, and a score of 6 or greater on the classification criteria for RA scale. Treatment and medication. Medication is used to reduce inflammation and joint damage. Corticosteroid medications such as prednisone are quick-acting anti-inflammatory medications that may be used while waiting for non-steroidal anti-inflammatory drugs or waiting for disease-modifying anti-rheumatic drugs, also called DMARDs. So DMARD drugs modify the course of the disease by stopping the immune system from attacking healthy tissues. They can be given by mouth, self-injected, or given as an infusion. Biologics are a subset of DMARDs that work more quickly as they target specific steps in the inflammatory process. They are injected or given by infusion in a doctor's office, so they are not as convenient. And then if it comes down to it, as a last resort, surgery may be needed to repair tendons or for a joint replacement to relieve pain and restore function in severely damaged joints. Research shows that adult patients with RA who receive stable biologics report reduced disease signs and symptoms by greater than 20%. X-ray analysis has demonstrated less disease progression with use of DMARDs drugs. Patients reported improved measures of physical function and health-related quality of life in a study by Strand, 1999. Other treatment methods include occupational therapy and physical therapy, chiropractic services for misalignment, monitor treating comorbidities related to RA, dietary modifications, and physical exercise. And dietary modifications mainly include incorporating anti-inflammatory foods into your diet. So you want to have a lot of protein, fiber, omega-3, and things like that, antioxidants, and you want to avoid a lot of sugary foods. So I wanted to just briefly mention how occupational therapy can be beneficial for someone suffering with RA. So we can help with pain using modalities, and here is a picture of a paraffin dip that can help to alleviate pain from swollen joints. We can provide adaptive equipment to assist in grip. So this includes button hooks, dressing aids, build-up grips for your pens, eating utensils, hairbrush, toothbrush. Splints preserve joint integrity and prevent contracture, especially with swan neck and boutonniere deformities. And then we can educate on lifestyle modifications and provide specific exercises to increase strength and range of motion. Prognosis. So prognosis is dependent on each individual. Factors that affect outcome include the patient's age at diagnosis, stage of RA, overall health, and compliance with treatment. If caught early on, and if the body responds well to the anti-inflammatory medications and other drugs that are used to treat RA, it is possible to put the disease in remission. And so the best outcomes are that you're going to stop inflammation, alleviate symptoms, prevent joint and organ damage, improve physical function and overall well-being, and reduce long-term complications. If RA is not treated, then outcomes will be poor. RA requires consistent management. And so if someone has RA and they do not receive treatment, they can expect joint destruction and deformity, loss of function, increased risk for cardiovascular and pulmonary diseases, osteoporosis, cancer, depression, and even pre-morbidity. This is why, as OT practitioners, we need to make sure that we're educating our patients on proper management techniques for their condition. And so patient education and awareness is crucial for those with RA to maintain optimal quality of life. Here are my references, and thank you for listening.